I'm Kevin Edwards of Allied Physicians Group, and thank you again for joining our COVID-19 patient-focused webinar series. Tonight's topic focuses on mental health. Our hope is to provide you with valuable answers to many of the questions you are facing during this pandemic. Just a few housekeeping details before we begin. You'll notice at the bottom there's a Q&A feature. If you have additional questions, feel free to type them in there. We'll try to get to them at the end if we have some time. Following this webinar, tomorrow we'll be sending out a link to this presentation that you can share and view as a resource. We'll also send over some other helpful information. Well, with that, I thank you again for joining us. I'd like to introduce Dr. Kerry Fierstein from Allied Physicians Group, who will be leading our discussion this evening.
Thank you, Kevin. This time I heard you. And thank you, Allied, for arranging this. COVID has certainly taken its toll on the US and the world, and maybe most so on New York. We all know someone who was sick or hospitalized or worse. We've all heard firsthand accounts by first responders. We all know someone who lost their job. At the beginning, the news was changing every day. There are still so many unknowns about the virus, our health, our finances, and society's next steps. Life has changed dramatically for us, and we are off balance. Our children's lives are similarly affected. They have lost all sense of normalcy. Like us, they don't know what is coming, but they don't have the experience or the skills to get through this. As parents, we want to help them. Judging by the response to this seminar and all the input from the audience, parents have lots of questions. Tonight's webinar will answer many of them. I'd like to start by having our panel of experts introduce themselves. So please tell us who you are, what you do, if you are taking new patients, and if you are seeing patients in the office or by telemed. So Dr. Lashley, let's start with you.
Well, hi, everybody, and thanks for joining us today. This is a great topic, and I'm really excited to talk about it. My name's Dr. Marc Lashley. I practice primarily at Valley Stream Pediatrics and at Island Pediatric Associates in Valley Stream in Nassau and in Rockaway Park, New York. I've been a pediatrician practicing for about 29 years. I was the past president of the Long Island chapter of the Academy of Pediatrics. I am accepting new patients, and we see patients both in the office and by telemedicine. Lately, mostly our sick patients are seen via telemedicine.
Great, thank you. Dr. Beth Feldman.
Hi, thank you everyone for dialing in, and thank you for setting this up. My name is Dr. Beth Feldman. I'm a clinical psychologist and a certified psychoanalyst. I see adolescents and adults, and I have advanced training in working with substance abuse and eating disorders. I also have a part of my practice that I call Sane Parenting in a Crazy World. It's a consultation part of my practice where I meet with a parent or parents for a limited number of sessions, and we talk about the difficulties their child or family is having, and we talk about some strategies, and together we kind of do an assessment to see what other referrals might be indicated.
Excellent. So there was a crazy world even before COVID.
It was a crazy world, particularly around here, even before COVID, yes. I am taking new patients. Right now I'm working remotely, but I'm hoping that'll change certainly by the summer.
Dr. Jennifer Addis.
Hi, everyone. I am Dr. Jennifer Addis. I'm happy to be here tonight, and I'm glad you are all here as well. I am a clinical psychologist. My specialty is working with children and adolescents in a wide variety of issues. I also see families and do a lot of parenting work. I am accepting new patients, and I have some limited hours, but I am accepting new patients. And right now, like Dr. Feldman, I am seeing all patients remotely, but hope to be back in the office as soon as I can.
Great, thank you. Amy Kaye.
Hi, everyone. Thanks for having me. My name is Amy Kaye. I'm a behavior and sleep training expert with over 20 years of experience working with children. I spent about 7 years in the public school setting. I also provided early intervention, special instruction, family training, was a SIA teacher also for about 8 years. And I've had a private practice for the past 7 years, primarily working with parents, teaching them how to work with their children in terms of their behavior and in terms of establishing healthy sleep habits. I come from a parent training approach where I work with parents, I teach them what to do, and then they implement the changes with their families.
Great. Thank you all for joining us tonight. Since developmental ability is so important in working with children, we're going to group the questions tonight by age, starting with toddlers, then school age, then teen. Some teens may be more immature, some younger kids may have an older soul. Intelligence and developmental maturity do not always match. So in listening to our answers, your child's age is just a general suggestion of developmental stage, and you as the parent know your child best. In each section, we will answer your questions and make sure we cover sleep and coping suggestions. And at the end, depending on time, we will answer questions that come up during the presentation. So I'm going to start with toddlers. And this first question is to Dr. Ratas. How do I find ways to be calmer with my child? I find myself losing patience easily now, and he's only 2. What different activities can I do with a 2-year-old who isn't quite speaking as much as the average 2-year-old?
Okay, so that's a couple of different things in one. The first thing that I want to say is we are all navigating this together, and we are all working and living and playing and helping each other under conditions that we are not accustomed to. And the first thing I think we have to keep in mind is that we all need to give ourselves and those around us a bit of a break. And I think the first thing that we need to do is recognize our own stress levels. Right. And I think that, we talk a lot about self-care in society today, but in terms of helping ourselves not to lose patience with our children, especially when they're young and when they may not be speaking as much, we need to make sure that we are concretely taking care of ourselves. Are we eating? Are we sleeping? Are we staying hydrated? Are we building in brief periods of time during the day where we can get a few minutes, read a few pages, watch a little bit, walk around the block, get some exercise, talk to a friend? It's so part of our coping as parents, what allows us to cope with our children, especially our young children, has to do with how it is that we take care of ourselves. And we have to remember that even our young kids, they pick up on us, and they pick up on what we're going through. So we need to give them that extra few minutes. And we need to just, if you are losing patience, then walk out of the room, take a few minutes, take a few breaths, go into the bathroom, get a drink of water. Be very mindful of those kinds of things. The more we take care of ourselves, the more patience we will have for our children. And especially when they are young, it's okay to take a few extra minutes. Think about how you want to respond. Think about what different ways to approach. An extra couple of minutes of difficult behavior or their tantruming, if that gives you the time to think about how you want to approach it, then that's helpful. When children are not speaking or not speaking as much as they should at 2, then it requires sometimes a little bit more creativity in terms of activities and keeping them busy. There has been, although I know we're going to talk about screen time later, but there have been so many programs, the children's museums and the parks and the zoos. There's all kinds of online activities, even appropriate for young children, that you can do with your kids. There's any kinds of art, anything that develops fine motor skill, coloring, any kind of playing, any kind of interacting. It really, don't worry so much about what you're doing, and so much as it is time spent together. Kids bond over time with their parents. They're not going to remember what activities they did at 2 or what they did during this time. And their development is going to be okay because they have years of development ahead of them, right? It's about time that makes you feel good with them and keeps them with you and keeps them calm and allows you to be the kind of parent you want to be and do the things you want to do.
Thank you. That's a great answer. One of the few bright spots in all of this is that we all do have more time to be at home. Mm-hmm. And we should enjoy some of it, right? Yes, but parents also don't have the help that they used to have. Yeah. And toddlers are so difficult, babies, toddlers. And grandma coming and spelling you for a few hours was really something that parents look forward to. Yes. And lots of time that's not happening.
Yeah.
So, we're social quarantining as well as our kids, which brings me to our next question. So, Dr. Lashley, I'm interested in thoughts on how to help with anxiety, fears regarding being around others. My 2-year-old was very social before the quarantine. Now when she sees people on the street, she says, no people. When we return to normal, how do I help manage this?
So that's a great question. And it actually dovetails very nicely with the last question, because where does a toddler get their perception of the world from? Primarily, it's from us as parents, right? I mean, we are the ones that model social behavior. They are little parrots. They pick up their language from us. They learn social expressions from us and learn how to perceive facial expressions and anxiety. And guess what? They are exquisitely sensitive to any kind of emotion that you as a parent might be feeling. So if you yourself are feeling stressed or anxious, because appropriately, we're all stressed and anxious right now, many psychologists and pediatricians have recommended that you project a feeling of calm, even if you are not truly feeling it yourself. So you want your child to understand that everything's under control, that you are not anxious, that yes, the world is a little bit strange right now, but a toddler doesn't understand that the world has really changed. They just understand what right now is. And if right now your mood is anxious and you are worried and you're making comments about how dangerous the world is, maybe it's not so great an idea to make those comments in front of your toddler. What your toddler needs at this developmental stage is to understand that everything's under control, that you love them, and that they are safe. So even if you're not feeling it yourself, the advice is to project that to them and let them know that everything is safe.
And maybe shut off the TV for a while so that you're not hearing the news all day long.
Right, and just don't watch it in front of them also. And maybe you can tape it, and that could be something you could do when the toddler goes to sleep.
Excellent. So Dr. Ratas, my 4.5-year-old has been hitting more than usual. How do you recommend we respond when this behavior happens? And how can we use positive reinforcement to prevent the behavior? And after Dr. Ratas, I'm like Amy Kaye to comment, because I know behavior mod and stuff is something that you do a lot.
So I'm really happy that question involves the positive reinforcement part, because I think that's incredibly important, especially at the 4-year-old level, and especially given the context of what's going on. So, at 4, children who are hitting more are usually doing so out of an expression of their emotions that they are having difficulty putting their words to. So whether it's a matter of picking up on the stress, or whether something has changed in the environment, or whether your 4-year-old is having his or her own feelings about what it is that's going on. At 4, kids aren't aggressive for the sake of being aggressive. That kind of hitting we call instrumental hitting, and it's the idea that it comes out of a feeling they're having, whether they're frustrated or stressed or worried or upset. So it's important to stay calm, to stay neutral, and to approach that behavior in terms of trying to understand what can be, what the toddler, what your 4-year-old is trying to express to you, right? So your 4-year-old hits you, and in a calm, neutral voice, you say, "We don't hit. Please use your words. What's wrong? This is what we can do instead. Tell me I'm angry. Tell me I wanted my juice. Tell me I don't want to go to bed." So when they can't give us those words themselves, we as their parents try to figure out what might be going on. We give them that modeling of those words, right? This is how we express ourselves. We don't use our hands, we use our words. These are the things that we can say. And then when we reinforce, and Amy, you can jump in, we reinforce when they're able to then imitate the model we are behaving. Right? So when they say to you, "I'm angry," or "I want my juice," we positively reinforce that. The best positive reinforcement is verbal. "I'm so proud of you. You used your words. That's what we do." And that's one level at which we can use that positive reinforcement. The other way we can use it is to set up like a very simple contract and say, you know, in this house, we use our words, we don't hit. You know, in the morning, if you use your words and don't hit, you can put a token in a jar, a coin in a jar. There's all different kinds of positive reinforcement things to use. And then let those positive reinforcements add up to something special, whether they want, you know, a prize that you can order, whether they want a special dessert, whether they want special time with mom or dad, whether they want to play a particular game, whether they can earn those things for going the morning without using their hands, the afternoon without their hands. We want to break up the day. Anytime you use positive reinforcement, you want it to be super manageable. So a single behavior, in this house, we use our words and not our hands. And every time they do that, they get, you know, a check mark, a sticker, a token. My favorite one is to, you know, to print out a picture of something they want to do or something they want to eat. You can cut it up into puzzle pieces. And every time they do it, they earn a piece of that puzzle. When the picture is complete, they get to do that activity. So just sort of a simple, straightforward, this is how we model, we redirect their behavior, and then we positively reinforce them doing the right thing.
Yeah, I
So
think that,
certainly a very complete answer. Do you have anything to add, Amy?
no, just to add and say, you know, agree with a few points. You know, keeping it simple when you explain things to them is super important. Remember that they're only 4 or only 3, and they're not interpreting the things that are happening the way our 40-something-year-old brain is thinking about it. Also, like you suggested, praising. Give it positive attention to the behaviors that you want to increase and try to ignore the behaviors that you want to decrease. And then in terms of piggyback, I think reward systems are great. I think a mistake that parents do make with reward systems is waiting too long to give the reward.
Mm-hmm.
So I think especially with a 4-year-old, they might need that reward, like you said, after 3 hours, whether it's broken up into the morning and the afternoon, or maybe within the day, but not longer than that. The mistake parents make is having these check systems where they have to get so many checks and they don't get the reward for a few days, and then the reward loses its value.
And Amy and Jennifer, don't you agree that another mistake or misstep parents might make is that the ratio between benefits and negative reinforcement, how that should be, that really there should be 5 or 10 positive reinforcements to every negative reinforcement. Because I think that there are a lot of parents whose style is to crack down on negative behavior in a really severe way. And it's appropriate, you know, to say no. That's not right.
Yeah.
You can't do that. You can't hit. You can't bite. And maybe to give a timeout if that's what the parent wants to do. But for every negative reinforcement of a behavior, there should be many more positives. Because if you're just always giving out negative and no positive, then you're just an ogre, and the child will just discount you as being an ogre. But if you give a lot of positive reinforcement, that is very addictive, and children will try to get that positive reaction out of you even better than the negative one.
Agreed. I don't think
that's.
Go ahead. No, that's okay.
I think that's an important point, because I think, you know, as parents, there's a natural tendency to sort of err on the side of consequence. And, you know, in the world, and you can speak to this, in the world of behavioral training, what I always tell parents is that the money is really on positive reinforcement. It is scientifically proven to be a much more effective means of modifying behavior than consequences are. And so the use of positive reinforcement is much more beneficial than consequating, as is modeling, because also remember that the 3 or 4-year-old who's hitting you out of frustration doesn't know how to replace that behavior. So by modeling what you want them to do, you're teaching them this is what we do instead of that, so that we don't assume they actually know what to do instead of hitting you, because they don't necessarily. We have to also give them that replacement behavior. And consequences don't really teach either of those things. They don't teach the replacement behavior, and they don't sort of reinforce what's good.
Exactly. Well said.
Great. Yeah. Thank you. Before we move on, I want to introduce a surprise panelist. He didn't know if he could make it with us tonight because he was seeing patients. So Dr. Jamie Parles, if you could tell us your credentials, what you do, if you're seeing new patients, if you're using telemed or in person, just a little quick bio.
Yes, to all. So I'm a, my background and training is in general pediatrics. I worked, in a large, busy pediatric practice for 28 years, which was actually one of the original practices within Allied. And about 4 years ago, I started a behavior-only practice. I treat children with ADHD, anxiety, depression, obsessive compulsive disorder, PTSD, behavioral problems related to autism. I'm doing exclusively telemed, while that's the safest way to do it, and anticipating a time we can be in person again. And I am taking new patients. Unfortunately, the lead time for a new patient appointment is significant, which I regret but can't help. It's an underserved part of pediatrics, which is part of the reason that I got to it. But all right, enough about me.
Okay, well, hopefully we'll be giving people some good answers tonight and they can wait for you. So one more toddler question. This is for Amy. I sleep trained my 2-year-old and she was doing great, and now she won't fall asleep without us being in the room with her. With so much going on, can I still let her cry?
It's a tough thing. When you work on sleep, you work on 2 things: getting the body more rest, so the baby or the child has an easier time falling asleep, and staying asleep, which is timing. And then a clear and consistent way of managing all these behaviors related to going to bed, middle of night awakenings, and the early morning hours. For a young child, if everything in their home environment is stable, in my opinion, there's nothing wrong with some protest crying in that moment. I do believe in an extinction approach, in the evening, where, you have a bedtime routine, you make sure that the timing is right, because that's what sets the child up to be successful. And then you allow the child to put themselves to sleep on their own. I don't view it as mean or neglectful. I think it's a clear message to the child in terms of what they have to do. So to answer your question, if the child is comfortable, if the parent is comfortable during this time and there's a stable home environment, I think it's absolutely okay to do that. And I think the benefits will outweigh any negative that the parent might be feeling.
Great. So as we end this section, I'm just going to summarize some of the tips that came out. So project confidence, project calm. That was one. Give a lot of positive reinforcement for kids this age. And then one thing we missed, I think, is keep a regular schedule. I mean, that it didn't come up based on the questions, right? But for children, having some regular schedule is really important. Even our toddlers, when they've been in daycare or nursery school, they know exactly what happens at what time, and that's really helpful for them. So we're running a little late on this section, but is there any other coping tip that was really important that we missed?
I just wanted to add, in terms of the structure and the schedule, I think that that's important for toddlers all the way up until adults. I think especially with regards to tantrums, if kids know what to expect, what's going to happen next, they'll definitely have an easier time transitioning. And I think it's best to really try to keep that same schedule almost every day. Even though it'll start to become boring, it will start to provide the child with comfort and control, which is really what they're craving.
Excellent.
Did anybody talk about getting outside every day? That's possible?
Not yet.
Okay.
Not yet.
Okay.
That should be in the schedule.
Okay. Yeah.
Yeah.
Okay.
So Dr. Ratas, we're gonna now move on to school age children. I'm having trouble getting my 5-year-old motivated to do schoolwork or much of anything. What do you suggest?
So that answer for me really piggybacks on the things that we have just been talking about. So One, I think structure here is incredibly important because not only does it provide that that safety, but it sets expectations. It lets the child know what the day is going to involve, and and what to expect at each step along the way, right? So just as though when life was typical and normal, just like this was breakfast time, this was leave for school time, this was homework time, that kind of structure will, at home, that kind of setup sort of takes away that amorphousness and allows the child to sort of have a set of expectations. And 5-year-olds need that, right? They're used to a structured kindergarten or first grade class. They need to know what to expect all along the way throughout the day. And I think that will go a long way in helping kids to be able to do what they need to do. And then the other piece is, and I'm going to come back to what it is that I said before about the endless benefit of positive reinforcement, right? Is that when their life is different, and they're struggling just like we are, and so the use of positive reinforcement when they do what they're supposed to do is incredibly important. And you can break up what they need to do into smaller components, to the point that Amy made before. So this way, if they have 3 sheets of homework for school that needs to be done, that should be structured concretely into the day at 3 different times with a positive reinforcement attached to getting those things done along the way. So breaking up tasks, structure, and positive reinforcement are really the ways at 5 to get kids back into a routine and doing the things that they need to do.
Great, thank you. So we have a lot of questions about homeschooling. Apparently parents are not so happy being teachers. We are getting a great deal of resistance from our kids, 6 and nearly 10, regarding schoolwork and Google Meets. How can we help by setting reasonable expectations, yet be understanding that these are uncharted waters for them? Amy, do you have a response for that?
I think that, having a routine and structure is the start to being successful with these kids. I think a lot of kids are not having regular wake-up times and regular bedtimes, which can also attribute to being moody. I think it's also very important, in addition to sleeping, also to make sure that they're eating breakfast and lunch and dinner at regularly scheduled times, so that you're setting your child up to be as successful as possible. I know with my own boys who are 13 and 17, we definitely have some rules that we're following in terms of schoolwork. They have to do it in the morning, and if they do that, then they can play video games, and then they can do those types of things. So I think building that into the day is super important. And like Jen so eloquently pointed out, you can't give too much praise. I think a lot of times parents think their children should just do the right thing, but they need a lot of help doing that. So praising them for anything and everything that they're doing, and be very specific in that praise to help motivate them. But also, like, so many of you pointed out, not being so tough on yourself as a parent. Right now, giving yourself some slack, knowing some days are going to be harder than others. I know I've had that in my own life, where some days feel like when there was no school, my son was playing many more video games that I'm comfortable with. And I just had to say, it's okay. That's life. And tomorrow I'm going to try to make it a little bit better. But I think it's a very common problem, and I think that parents shouldn't feel alone with it.
Thank you. I'm going to ask one more question, and then Dr. Parles, I'd like your comment really on both of these because they're kind of related. Sometimes I feel like I am pushing my child too hard to get all of their distance learning schoolwork complete. I know they would at school, but at home I need to work while my husband is out at work. What is the happy, healthy, acceptable median?
Okay, so there's a lot, there's more than one question embedded in there. There is about getting schoolwork done, and then there is about how parents can navigate their child's school demands while also navigating their own work demands. Okay, and I think that the key comes in setting reasonable and appropriate expectations for everybody. This is, everybody is in uncharted waters, like somebody said before. The distance learning, online teaching is an educational experiment in teacherless school that is not going to work well for every child in every circumstance. Going back to the last question, Kerry, that you asked, the one thing I would add to Amy's answer is to make sure that what's being assigned is appropriate in both volume and content, because they're this is new to teachers too, and some of the teachers are having a hard time calibrating what they're supposed to do. So I have a bit of a different population in that every child in my practice has some sort of disorder or another. Most of them make getting stuff done difficult. I have a big ADHD population, a substantial autism population that'll struggle with something that is new, different, complicated, transitional. So what I'm telling parents is to not let schoolwork be stressful. I mean, if it's getting to the point of undue stress, take a break. And if on a given day, completing what's assigned causes undue stress, finish it tomorrow if possible. Now, for parents whose work demands are such that they can't establish the type of routine that's ideal for their children, which I agree involves doing work in the morning and having some reward time later in the day and some time outside and all that. But for some families, that I'm working with, that's not possible, and that really involves giving parents permission to be human, and to meet their own needs, to put on their own oxygen mask first, because if they don't meet their own needs at a time that is, unprecedented in any of our lives, they're not going to be in position to really help their kids, whether it's at 10 in the morning or 2 in the afternoon or right before dinner. So I think flexibility, I think having reasonable expectations and doing things or approaching things in a way that doesn't add to the already unbearable degree of stress that most people are feeling right now are the keys to maintaining a semblance of order and well-being during a very difficult time.
Yeah, we actually started when we talked about toddlers, about parents taking care of themselves and self-care and how important that is. So we're going to see that in every question that goes on. Dr. Lashley, for the neurotypical child, do you have anything that would be different or that you want to add?
You mean for the more atypical child? Is that what you said?
No, for the neurotypical, because Dr. Parles deals exclusively with children that have learning or other issues.
So what you're saying in layman's terms, Dr. Fierstein, is for a child who doesn't have mental disabilities or autism or something like that. And actually their needs are not very much far apart. Normal children, so-called normal children, need structure. They need playtime. They need time outside, like Dr. Parles said. And they need the parents to know that everything's okay, like we said before, and that they're loved and safe. So if you can provide them with a structure, a feeling of calm and safety, exercise, time in nature, if possible, it all goes a long way to calm them and to make them feel in a good mood and like they're getting some.
Great. So let's move from schooling to anxiety. There are a lot of questions related to that. So how do you ease anxiety for an 8-year-old? My son is afraid to walk out of the house for fear of getting sick. Amy, you want to try that one?
For an 8-year-old,
Yeah.
I think maybe Dr. Ratas might be better at answering that question.
Okay. Sorry about that.
That's okay.
I'll
That's
have
okay
that
with you, Dr. Addis.
It's perfectly fine with me. I'll have that one. There is a lot of, there are a lot of different ways to ease anxiety, and that you could do an entire webinar on how to ease anxiety in any age group. I think what's really important here, what I always tell my families and my kids is that anxiety, there's the typical anxiety that we all have, right? This is an anxiety producing situation. We all have a lot of questions, but then there is the anxiety that kind of runs away and is not so logical and not so truthful and more catastrophizing than it needs to be. And so for an 8-year-old, for example, who's having trouble stepping outside, that anxiety is more than it needs to be, because that child believes that stepping outside is dangerous. And so one of the best anxiety management strategies we can provide is the right information, is the sense of calm, is a sense of reality testing and truth, right? So, you know, Dr. Lashley talked about projecting calm. So when you say to your child, it's okay, I'm stepping outside, right? We wouldn't be stepping outside if it was a dangerous thing to do. We tell children they have an anxiety voice, right? As though their anxiety speaks to them. Your anxiety is telling you it's dangerous to go outside, but I'm your mother, you trust me, I wouldn't do anything to put myself or you in danger. So our voice of strength says it's okay to go outside. So we're providing that sense of calm, and we're also providing that reality testing, right? This is what we know to be true. This is what is okay to do. And we work with kids to not listen to that anxiety. You know, there is always the taking deep breaths and paying attention to inside your body and helping your body feel calm through doing that. But a lot of anxiety really is cognitive, meaning a lot of it resides in our thoughts, things that we think. And for our children, we need to provide them that reality testing. This is okay to do. We wouldn't be doing it if it was dangerous.
And Amy, not to interrupt you, I'm sorry,
Yeah,
but a good analogy would be fire is dangerous. In the kitchen, we teach our children to be careful with fire. Does that mean we should be afraid to go in the kitchen?
Correct.
No, it's just that this is new. It's new to everybody. It's uncharted water for us. So we have to show our kids, yes, we have to be careful. Yes, there are precautions, but that doesn't mean we have to live in fear. Just be careful.
And you don't want them to get stuck also. So you want to help them get through it. I actually had a similar situation with my own son, who's 17, who has ADD and some OCD recently. And we were going to go out this weekend, and he became very fearful about going outside. And I said exactly the things you said, Jen. I made it simple. I said, Mom would only put you in a safe situation.
Right.
If you're having some concerns, I want to set up a telemedicine appointment with Dr. Fierstein, with a psychiatrist, because we need to get this information. Yeah. We moved along. I praised him overboard for praise, and he felt great. And so did I as his mom. Yeah. Because if we didn't do that, I would have started to worry. Because you know, now for a lot of kids and a lot of people, we're home and we're safe. It's going to be going back into the world. Mm-hmm. It's going to become super challenging too.
And I just want to say, you made a very good point, Amy, about moving on, right? Mm-hmm. You know, when we are anxious about something, it's very easy to avoid the thing that's making us anxious, because when we avoid what's making us anxious, the anxiety goes away because we're not doing that thing. Right. Except that really what it does, that avoidance, is that it just makes the anxiety stronger because you're not facing it. You're not moving on. So what's incredibly important is that even though you or your child might be anxious about something, that you do that you use these strategies to sort of push through and move on, because once you have that success, not only does the anxiety diminish, but then you begin to feel much more positively about your experience and the experience that your child is having.
Absolutely. And I think as parents, even having all these strategies, when it's your own child and they're experiencing something, it's just harder, and it's harder to think clearer. So having a plan ahead of time of how you're going to manage it will definitely help.
Excellent. So continuing with anxiety, our son is struggling every night when trying to go to bed. He's complaining of stomach pain and talks about his fears with seeing people in masks and gloves. He's scared of people dying from this virus. We are struggling with how to handle bedtime. So that's also two questions, right? Bedtime and anxiety. Dr. Lashley, did you want to?
What was the age of this child?
It doesn't say, but I'm
Oh.
assuming he's a school ager because I put him in this category.
Okay. Well, certainly sleep problems are managed differently depending on the age of the child. So if we're talking about a young school age child, first of all, structure, as we mentioned before, is very important. A set schedule. We can't allow children who are having sensitivity issues or problems falling asleep to be going to bed at 9 o'clock one night, 11 o'clock another night. Certainly there are a lot of children that can do this successfully. On weekends, have a great time. Although these days, my wife joked, we don't know what a weekend is anymore. But it's very important for children who are having trouble to have structure. So you want to set bedtime. You want to make that pretty firm. There can be a little leeway with it, but try to make it the same time every night whenever possible. Let there be some kind of ritual before bedtime. So it could be shower time, it could be electronics time. Although actually, I'm going to take that back. Electronics are not the best thing to do just before going to bed, because there are some studies that show that your brain needs time to process electronic images from any kind of a screen. And within an hour of trying to initiate sleep, electronics can interfere with sleep. So once you've established a pretty firm bedtime and make sure that your child had an outlet during the day, that's probably the most important thing to do. Now, if a child is having trouble falling asleep, laying awake in bed, for example, and just staring at the ceiling, it is acceptable to use melatonin. Many pediatricians have recommended it, and it is generally considered to be safe and non-addictive. You get it over the counter. A good starting dose can be 2 milligrams. You can go as high as 5 milligrams, and parents can use it safely. It's a natural substance. Nobody really thinks it's dangerous or a problem to use. I wouldn't want to get in the habit of using it all the time, but they do have it as a gummy or as drops. And if your child wakes in the middle of the night, which is another problem that can happen, they do have an extended release melatonin. But you'll find that once you establish a strict bedtime, sleep is more profound and easier to initiate. So I think that's probably my biggest point.
Right, and I do think it's important that we don't just rely on the pills, which you said you have to create all the structure that makes it happen. Amy, do you have anything to add to that?
Yeah, I was just going to add in terms of if a child is having a hard time falling asleep at night, that might be a sign that the child is going to bed too late in the evening. So you might want to look at that and consider moving the bedtime back 20 minutes at a time. And if the child's able to fall asleep easier, after a few days, consider moving it earlier. I think the biggest mistake that parents make in general is putting their kids to bed too late. Most people think if they put their child to bed later, they're going to sleep later, which isn't the case. Typically around 12 or 13, kids will start to sleep a little bit later. In terms of the anxiety, it's a very interesting thing. I've gotten quite a few calls recently about this. And I think the age is also very important, to look at as well. And also if the child was having any sleep challenges before the pandemic as well. In my opinion, and I'd love some chiming in, but, in my experience, if the child, typically separates easily, is functioning well during the day, and isn't talking about any of these fears or concerns, during the day and only at nighttime, it may be, and may is an important word, be an attention-seeking behavior, as well. But it's really important, to look at the individual case. If a child's having anxiety throughout the day, complaining of stomach aches, talking about masks and fears, I think that's definitely a sign to get some professional, help, whether it be from the pediatrician or a psychologist or a psychiatrist. Parents, often tell me, it is only at night that they're doing this, and they've learned powerful words, and really providing that structure and routine, having a consistent bedtime, a consistent wake up time, will help with all of that.
Great. I want to move on to the teens because Dr. Feldman's been sitting so quietly.
It doesn't happen very often.
We do have a lot to get to, and we want to keep it to about an hour. Okay, so coping tips for the school age kids. Same thing, parents should take care of themselves first. Don't be overstressed about schoolwork. Try and keep a schedule. Do the work in the morning. Make sure you have some outdoor time as best you can. A lot of positive reinforcement. Anxieties are normal at this time. Do a lot of projecting calm, a lot of setting of, normalcy and fact checking. And then, one thing to add, which I think you said, Amy, is that a lot of our kids have some baseline anxieties to begin with, and this is making everything worse. So don't be afraid to reach out and ask your pediatrician for help in how do you get through all this. And it may involve a referral. It may, to a health professional, to one of you guys. It may just require a conversation and some things to do. But I'm going to move us along to teenagers. And Dr. Feldman, what do you tell your teens that are home and self-isolate from friends and family?
Okay. Let me answer a question that I think is inherent in all of these questions, and then I'll specify that. Because my approach is a little bit different, and it's not either or, particularly with teenagers. I think we need to approach teenagers by managing our anxiety, but by talking with them about our anxiety and not pretending we don't have it, but by being very authentic and by offering realistic, reasonable reassurance. I think that we need to encourage our kids to talk about their anxieties, to talk about their feelings, to talk about why they're isolating, to talk about their concerns, but in great detail, not just in headlines. A lot of parents feel like, well, if they go into it in great detail, then it's going to feel more real or more important to them. And my experience is that it gives them a great deal of relief when they actually put things into words and get it out. I ask kids to talk to me about what they're thinking about when they're falling asleep, what they're worried about when they're falling asleep, what they worry about as soon as they wake up, what they dream about. So getting kids to put their feelings and their anxieties into words. Super important, I just need to put this out there. One of the most wonderful things parents can do is to regulate the stress and the hostility in the home. We all fight with our spouses, but I suggest we have a pandemic truce when there are any kind of typical arguments, because the less arguing in the house, the better. Everybody is kind of a captive in the same place. Another thing that's really helpful with kids who are self-isolating is to preview. We are going to get to the other side of this. We're going to get to the other side of this together. Which friend are you going to call first when we can go out and be with friends again? What activity do you want to do first when you can go out with your friends? What are you going to order first when we all go out for dinner? Get them to start, teenagers and kids in general, but they're prisoners of the moment. So get them to start anticipating when life gets back to the new normal even, what they're going to do and what connections they want to make, and then say, so what's going to help that along? How can you reach out to people now? Really get them to talk about things. And the other thing to do as much as possible is to play. And particularly, teenagers might not be first in line to play board games or to go back to some of those early things that we did with our kids, but they love it when they do it. So the more playing, the better.
Great. Want to add something?
Well, I think that I really like the idea of validating, your teenager's anxiety by delving into it. If you talk about it in a way that makes it clear that you don't want to talk about it anymore, that ends up being potentially feel, teenager tends to feel dismissed, and then has the opportunity to worry more about, why don't you really want to talk about it? Is it worse than what I'm thinking? Okay, the unknown is often more anxiety provoking than actual reality, and I think that there are some parents who worry that they're going to make their kids worry more by admitting that they're worrying, when in actuality, just validating the worry and listening. You don't even have to say very much, but just listening is very validating and calming, I think.
It's also important with teens to find out what information they know, because they're surfing the web more than we are.
Not adults. You don't have to do that with adults, Carrie.
I also think the more that we talk to them about what they know, and the more that we help them cultivate their own opinions, the more they have a sense of control and a sense of competence. And those are two things that get to the heart of anxiety, right? Anxiety is really triggered by a sense of being helpless and out of control and overwhelmed with fear. When you help a kid develop a sense of competence and a sense of control by putting their feelings into words and formulating their understanding into opinions, that helps them combat the anxiety.
So, this question seems to be somewhat about control as well. My 14-year-old teen, who is an honor student and takes her studies very seriously, all of a sudden is missing homework assignments, doesn't seem to care, and is more moodier than ever. I took her phone away, which seemed to inflame the situation. What do you suggest?
I'm a big believer in the words good enough. I think that as parents, we need to just do good enough right now. And I think with our kids, the focus, fortunately or unfortunately, used to be so performance. And I think we need to substitute calm, cooperation, and a sense of kind of silver linings, family moments, with the idea of putting so much emphasis on schoolwork and performance. And I would say to them, listen, sweetheart, this is your job. Just do it good enough. Do your part of the job. I'll do my part of the job, and we'll get through this together. So I would be kind of matter of fact about it. And, you tell people, just give me 85%. I don't need 100% here. And a lot of the resistance goes away.
Mm-hmm. So you talk about, time together. One of the questions involves teenagers' sleep patterns. A lot of the teenagers are up until 4 or 5 o'clock in the morning, and then they're sleeping all day long, and they're missing a lot of the family togetherness. Does anybody want to take that one on?
Well, I have a patient who has been waking at 7 p.m. and going to bed at 7 a.m. And the mom is exasperated, and the whole.
I have that patient too, by the way.
Yeah, I think we all do.
It's common.
Right. So what I really felt with this particular patient, and it may not apply to everybody who's listening, is that this parent really has lost their parental authority. They have really not been able to affect the child's behavior. And that's because all of our worlds are upside down right now. It's very hard to make rules and enforce them. And parents themselves are having trouble regulating their executive functioning. So I think that it goes back to what we said before about setting limits and rules. And I think that your comment, Beth, about good enough is good to a point, but here's an extreme, right? Here's a child who's waking up at 7 p.m., losing the whole day, not being part of the family. I think we need a more approach here, or a more firm hand from the parent. And sometimes it's very hard if you're not used to being a firm parent, how to do that. You really need to work with a therapist at this point to try to get that going sometimes.
I see this all day long with teenagers, and I try to think about, how do I get buy-in here? Because parents can't make kids sleep They can't make them eat. They can't make them go to the bathroom. You know, they can't make them do anything. So the approach that popped into my head one day is I said to this kid, you're on the night shift. You know, you're working the night shift. And then I told a little bit of a white lie, but really, you know, something that's close enough to the truth that there have been studies on people who work the night shift, and that a lot of them during their night shift work, they have markers of declining both physical and mental health while they're working the night shift, and that they don't want that from unnecessarily working the night shift. And I think that you know, I see the kids, you know, sort of eyebrows raise a little bit, and most of them engage on that. And I, you know, I don't, it's too soon to know whether it's effective, but it's you know, it was a way that I thought of to try to get some buy-in. If I could go back just real quickly to the last one that you asked Beth about, the kid who stopped doing her work, is just a precaution about anybody, you know, who has an abrupt change in pattern of behavior. You got to at least think about whether they become depressed. So if that, you know, if adjusting expectations and, you know, talking through it does not, you know, affect any sort of positive change, that's something to, you know, to bring up with, you know, with your doctor, because that's sort of a high risk story for depression with an abrupt change like that.
I agree.
Great. Technology and teens. Does anybody want to comment on how many hours is too many hours of video games right now?
Well, I answered that in the chat box on a patient who was talking about it. The official answer is the Academy of Pediatrics. The Academy of Pediatrics says for a teen, it shouldn't really exceed for recreation 2 hours a day. We would like 1 hour, but 2 hours a day. Right now, I think that's not reasonable. We're really stuck in our homes. Many people are quarantined, and what are we expecting them to do all day? So I think that was it Jennifer or Amy? I think it was Amy who said that games are a good thing to do and are fun, and they do enjoy them. But how much games can we play? I mean, some teenagers have very little schoolwork. I was surprised after talking to many of my patients that I asked them what is their day like? That's what I ask almost every patient now on every visit. So what's your day like? And some kids have a tremendous amount of work, and some kids have none, or for some college students, their classes are over or canceled. And how are they supposed to spend their day if it's raining outside and they can't get some fresh air? So I think that we have to be lenient. One of the things I said in the answer, if you can read the printed out questions, is how is that time on technology and electronics affecting your child? Is it calming, or is it causing agitation and addictive type behavior and sleep disturbance? So you really have to see and check in with your child about how this technology is affecting them, rather than looking at the total time.
Great. So I think we're going to wrap up, but I want to wrap up with this question. What kind of long-term effect will this have on our children? So does anybody want to take that one?
I mean, I'll say this, because I don't know, as nobody else has, you know, knows what to say to that, because I don't know that we know the answer to that question, since, you know, it's not like we all went to school and everybody said this is what happens in a global pandemic. Right. I will say this, and then everybody can sort of say their piece. I think one of the things we have to remember is that children and adolescents are incredibly resilient, and that throughout development, children have an ability, because they are constantly growing and changing, and their expectations of the world around them, and they don't have an adult set of ways of this is how our world functions. You know, every developmental stage brings another developmental set of tasks and expectations and changes. And one of the positive things that brings is sometimes I think a greater resiliency than we have as adults, because they have a greater flexibility and acceptance of change. And so while this will have effects on all of us, I also think that we have to remember how resilient our kids are.
I love that answer.
I love it too.
I would also say, every home's experience of this pandemic is different. Some people have lost people. Other people have been sick themselves. Other families have first responders who are going into the lion's den every day. So every family has a different experience. I think we have to be tuned into that. I think we also, particularly for the teenagers, have to be tuned into the losses that they're experiencing. Because these kids have kind of special moments stolen from them. I think that's the feeling. Kids who lose the prom, or they lose graduation, or they lose, a sports season that they were so looking forward to. And their whole world is around their social life, or a big part of their world is around their social life, and they lose a big part of that contact. So I think we have to be, how we manage all that and how we talk about it with them and make room for them to process it is also going to impact how this affects them down the road.
And I just want to piggyback with all that praise and how important it is. And, definitely praising, your children when they do talk to you and letting them know how happy it is when they share their feelings with you. As simple as that may be, will definitely, promote them doing it, more often, as well.
And I also think it's great to show children and to help them help others. There have been so many, what do they say? Mr. Rogers said, look for the helpers. I know our office has been contacted by teenagers who had 3D printers, and they're making face shields and mask extenders, and children are writing letters to first responders, and things that get you out of yourself and in a helping mode for somebody else is always a good thing.
Absolutely.
So at this point, I think we're going to end it at 8:05. Kevin, was there anything that was?
No, I thank you all. It was great. We're getting some positive responses back through the Q&A. And Dr. Lashley, thank you. You jumped on the Q&A and answered some of these questions. But like I said, I think we covered a lot of the main topics. And I appreciate everybody taking the time out this evening and joining us. We'll be doing more of these series, so you'll see more from us coming in the next weeks. And again, stay safe. And thank you very much. Thank you, panel.
Thank you, everybody.
Thank you.